last question, which I thought was a great one. I hadn't really thought of this before, and it's sort of good doing an activity like this or an exercise like this for me, because it really tells me what some of the people who are planning on having surgery or have had surgery, where where their questions are coming from and what's really intriguing to them. So the question is from Shane Allen, and it says, what should I make sure gets covered in my first post-operative visit? So I think there's a couple of things, Shane, like we talked about a little bit earlier on. We want to make sure if there were restrictions that you had after surgery, so some precautions, whether or not those precautions are still in play and for how much longer they're in play. Often people come back and ask and want to know about when they can return to work or when they can expect to return to work. So I would cover that as well with your surgeon. Some of the other things that people bring up that I think are important are the medications that they go home with after surgery. If people are lucky, sometimes people are lucky enough to have a pretty short list of medications, but often, joint replacements are being performed in patients who are a little bit older, have a few more medical comorbidities, and they often have a long list of medications. And they want to know, when can I get off the medications that you sent me home on? So it's important to ask about narcotic medications, and when you can anticipate sort of stopping those. And often it depends on how well you're recovering, from your joint replacement. And then the other thing that you want to make sure that you touch on, because it's a very important concept in joint replacement, are the anticoagulants or the blood thinners after surgery. So common blood thinners that patients often get sent home with or are put on immediately after surgery are things like Lobenox or a heparin-based injection. Sometimes it's a fondaparinux. The other common ones are a Coumadin or a warfarin. And then more and more commonly, we're seeing patients who are placed on aspirin after surgery. That's something that I use. And the reason that you really want to ask your surgeon about this is to make sure that you're not on those anticoagulants for any extended period of time, because like any other medications, they can have side effects, and they do have issues related to bleeding after surgery if you have some kind of an inadvertent trauma after your surgery. So it's important to try and get off of those as soon as possible. So those are really the main questions that jump to mind that I think about after total joint replacement, that I make sure that I cover with all of my patients in clinic, in addition to just how their recovery is going. And don't be afraid to ask your surgeon, where they think you are in their overall group of patients. Do you think are you on pace for doing very well after this replacement? Do you think that I'm a little bit behind? Because often that can give you some insight into where you are and how hard you need to work moving forward to make sure that you rehabilitate well from these surgeries going forward.